Thank you, Natalie, for inviting me, and thank you to Nanit for actually entering in a collaboration with us. My talk is going to be a little bit different because we have started very recently. So it's more of a review as to why we care to study sleep in this particularly vulnerable population. So let me just start by telling you a little bit, reminding you about what autism is all about. As I'm sure all of you know, autism is a highly heritable neurodevelopmental disorder that is characterized by two core sets of deficits: social communicative deficits, so social interaction difficulties, and language development delays, and in some cases, even failure to develop any language, and as well as restrictive and repetitive behaviors, which if a person is severely affected will include hands flapping or even self-injurious behavior, whereas in more high functioning individuals, it would, for instance, manifest as a particular interest, like video games, that a child may absolutely be in love with. The important thing here is to stress the spectrum word, because it's not just a level of how a child may be developmentally delayed from a cognitive perspective. It's really this word that's meant to capture the incredible heterogeneity that we see in individuals with a diagnosis, and that hampers our ability to understand the mechanism, because we understand now that we should talk about the autisms, meaning that there are many different causes that may lead to this set of behaviors. But what autism has received a tremendous attention because its prevalence has been going up over the past 20 years or so. So if you see here now, about one child in 44 by age 8 has received a diagnosis of autism. And when I started out in the field 20 years ago, it was like 1 in over 100. And every single time the CDC comes up with a different estimate, this number goes down. And indeed, people have been talking about an autism epidemics, which is a bit scary. At the same time, it's also worth pointing out that this may reflect not necessarily an epidemic, but rather increased awareness of the disorder, and also perhaps an increase in the number of youth that are getting a late diagnosis, whereas in the past they might have not been diagnosed with autism. They might have just been that socially awkward kid that doesn't have friends and doesn't play with anybody on the playground. But anyway, this rate is obviously prompting a lot of research in trying to figure out why this is happening and how can we develop better intervention. And one of the approaches that researchers have taken as far back as almost 20 years ago is to use this infant Sibs approach. So what we knew then is that because of the high heritability, if when a child is born in a family where there is already a child with an autism diagnosis, they have a much higher likelihood of developing autism themselves. Indeed, that rate is about 20%. And this is if there's only one child that already has a diagnosis. If you're talking about families where they may have 2 children that have a diagnosis, the rates are much higher, as high as 45%. So what it's also important to know that in these families, only maybe 1 out of 5, 20% of kids will develop a diagnosis. Another sizable chunk of these infants will actually develop suboptimal developmental outcome. They may have milder deficit on what we call the broader autism phenotypes, or they may have language delays. So what the researcher has started to think is that if we follow prospectively these infants who are the siblings of a child that has a diagnosis, we can actually detect what may be early markers of the disorder. Because autism is still, on average, not diagnosed before age 4. So we're missing a tremendous window of opportunity for early intervention very early on when we know that the brain is much more plastic. So basically, this is the infancy approach is basically following prospectively this babies, and longitudinally over time, we want to then compare the group of infants that are at high increased likelihood for developing autism versus the one that are at low likelihood because they do not have any sibling. And then actually as a refinement, once we know which of these youth are being, of these babies are received a diagnosis, we can compare the high likelihood babies who did receive a diagnosis versus the one who did not. So this research initially was focused on behavioral markers of ASD. And there has been, okay, I don't understand why I'm not able, okay. So this work has detected a number of atypicalities across many domains. So we're talking about overall, this group of infants show motor delays. They may also show a failure to orient to their name. They may show delayed language development, as I mentioned. They may also show atypicalities in their gazing at the face or eyes. Now, in the second year of life, we have been doing relatively good at finding markers that can kind of predict who is going to go on to develop autism. But in the predictive validity of any single one of these measures, it's still abysmally small. So you cannot actually just use this very simple test of whether the baby is going to orient when you call their name to know what this child is going to do. And what's more important is also that all of these predictors function well when you actually are enrolled as they are in our studies, where we can look at their developmental course, not just at one particular point in time. So making it very impractical for, say, pediatrician or parents to detect themselves this atypical developmental trajectory. And then the other things that emerged was that while we can pick up some of these atypical behaviors in the second year of life, in the first year of life, we are really struggling. There really are very, very few measures that can help. So why? Well, infants have a limited behavioral repertoire, if you will, and a lot of the things that we've been looking for in terms of social developments, emerge later in life. So what we started to think is, can the brain itself tell us something that behavior cannot? And so what a lot of research, more recently in the past 10 years or so, it began to focus on the brain in the early first year of life. And while there are a lot of, there is quite a bit of work that focused on EEG signatures, looking at pattern of electrical current, basically by recording the scalp. So many of you might have had an EEG. A lot of the more recent work is focused on using MRI. And then you can see here, with MRI in this population is done during natural sleep. It's not invasive. There is no radiation. There is no concern. And the babies are just, we protect their ears. The babies are put asleep by their mothers, and then we scan them while they are asleep. It poses some challenges. Happy to talk about it. But the most important thing is that we can do it. We can actually, without any invasive methods, study how the brain develops in this particular population in very young babies. So what do we know? After about a decade worth of study, we've learned a lot. A lot of these neuroimaging studies have identified a host of several differences between the young infants at high and low likelihood for developing autism, well before we see atypical behavior overt atypical behavior. Now, we have seen some differences as early as 6 weeks. A lot of the work in this area has been actually focused in the second half of the first year. And so, again, I would need an hour or more to give a presentation about all of these differerences, but these have include brain overt growth, increase axial cerebrospinal fluid, a typical pattern of functional and structural connectivity, so how the brain is connected. The list goes on and on. However, like what we've seen when we looked at behavioral marker, it's still the case we don't have any single measure that can actually tell us what is happening. So we need a better understanding of how these are related. So we basically launched the studies of this line of research 10 years ago. We wanted to identify typical patterns of brain activity and also connectivity that can precede these. And ultimately, the goal is to identify identified mechanism that can lead to the development of more informed and targeted and earlier intervention, as I mentioned, that can actually prevent perhaps even the full onset of symptoms. So we do MRIs in the first 6 to 9 months of life. We collect a host of behavioral measures through parent questionnaire. It encompasses social development, language development, ASD symptoms, but also motor development. And we typically then do a diagnostic assessment at either 24 or 36 months. And what we have started adding to this work is through Nanit is the assessment of sleep. Now, why do we care about sleep and autism? Well, we do know that sleep problems are extremely common in ASD, with prevalence rate as high as 80%. These include prolonged sleep latency. So these babies, you fall asleep, it takes you longer to fall asleep, you spend more time in bed and not sleeping. It involves a reduced duration and also more wakings once the sleep has started. And what is interesting is that the prevalence of these sleep issues correlates very nicely with core ASD symptoms. So basically, the more sleep problems an individual has, the more severe their autism symptoms are. Obviously, this also increases parental stress and it impacts negatively the quality of life in the families. So what do we know about sleep and brain development? I'm sad to say, we actually know very little. Of course, we know that sleep, I don't need to tell you this. I mean, I think the prior speaker have already hit this home. Infants spend a lot of time sleeping, and we know that that's crucial for the brain development, but really the nature of this relationship is almost uncharted territory. We know very little about sleep facilitate typical brain and atypical brain development. Now we do need to figure out how this sleep impact development and how this may predict outcomes later on, and that's exactly what we are now poised to do. We obviously required incredibly valid measure of sleep, and that's why we have decided to partner with Nanit, because you can also acquire this measure in other ways, but this is the best, most practical way to do so. Interestingly, sleep difficulties are actually one of the first concerns that parents raised, that we see parents raise with their pediatrician for babies that then get a diagnosis. And there has been at least one study where very early patterns of brain development have been they found a relationship between this early pattern of brain development and sleep issues. So I'm running out of time. I basically stay tuned. This is what we are set to do. I thank you for your attention, and I'm happy to have any question, but I think I talked maybe too long. Sorry. Thank you.